Good afternoon, and thank you for joining us for this important webinar hosted by NORC at University of Chicago. I'm Ashley Van Ness, Deputy Director of the Center on Public Safety and Justice at NORC, and I'll be moderating the exciting panel today. For context, NORC is a nonpartisan research organization dedicated to providing reliable data and research to support evidence-based policymaking. In fact, the Center on Public Safety and Justice was created to address the need for rigorous, accessible, and actionable research in the field. Today's session aims to connect research with policy, focusing on the study, New Insights from a National Survey on Youth Firearms Exposure, which examines youth and young adult exposure to firearms violence. Before we get started, I'd like to quickly go over our agenda and explain how we'll handle questions. More details will be placed in the chat in terms of guidelines for today's webinar. First, we're going to hear from each of our exciting expert panelists, and each presentation will last around 10 minutes. Following the presentation, I'll moderate a Q&A session with the panelists. Please feel free to submit your questions through the chat feature throughout the webinar, and I'll direct them to the panelists as time permits. Now I'd like to take a moment to introduce our distinguished speakers. First, Dr. Bruce Taylor, a senior fellow at NORC with almost 30 years of research experience in health and criminal justice, will provide an overview of the study, New Insights from a National Survey on Youth Firearms Exposure. Next, Ms. Nina Vinnick, an attorney, policy expert, and founder of Project Unloaded, will discuss her organization's efforts to empower youth with data-driven decisions. She'll also talk about how the NORC findings can aid in promoting firearm safety education and conversations. Finally, Dr. Sonali Rajan, a professor of health promotion and education at Columbia University, will speak about her research on firearms violence, school safety, and adverse childhood experiences, and how the study findings can inform school safety programming. And with that, we're ready to begin. I'm going to hand it over to Dr. Taylor.
Thank you. So good afternoon, everyone. Today I'm going to share new national data on how U.S. youth and young adults are exposed to firearms both directly and indirectly, and what that means for prevention. And these findings come from a CDC-funded study. Next slide, please. So to set the stage, firearms are now one of the leading causes of death for U.S. children, adolescents, and young adults. Homicide risk is especially concentrated among young Black men. Yet nationally representative studies of youth firearm violence do remain scarce, and which tends to skew our understanding ultimately how to design interventions as well. Next slide. Our goal in this study was to produce the first, what we thought of as longitudinal, nationally representative portrait focused on youth firearm violence, and to also identify risk and protective factors across individual, relational, school, and community levels. And as I mentioned, this was a 3-year grant from CDC. Next slide, please. Okay, yeah, we'll go to the next slide. Okay, thank you. So we surveyed 5,311 individuals aged 10 to 34 using NORC's Merispeak probability panel from September 2023 and to January 2024. The data are weighted so they represent the U.S. population. As I mentioned, we have collected the second wave, and we will be collecting a third wave. We're just not going to be presenting on that today. In terms of our measures, we asked about 3 direct behaviors, both carrying of firearms, victimizations associated with firearms, and the perpetration of firearm violence. Plus, we had a robust set of indirect exposures and self-harm items. All questions distinguished between lifetime, past year, and pre-18 experiences. Next slide. So to capture the bystander environment, we included 10 indirect exposure items, everything from hearing shots in the neighborhood to seeing threats online. That granularity really lets us see where prevention touch points really lie. Next slide. So starting with some of the key findings, 1 in 4 young people, which translates to about 29 million young persons, have ever carried a firearm, and protection seems to be the main reason that they're carrying them. Rates spike among men, young adults, and Black youth in the South. Uh, Prior research shows carrying a firearm increases your likelihood of being a victim or perpetrator. So that's one of the things that we were concerned, that we have a quarter of young Americans carrying these firearms. Okay, next slide, please. And looking at perpetration, nearly 1 in 10, roughly 10.7 million youth have been victims of firearm violence. Victimization is markedly higher among certain groups listed here, and you can see them here: men, young adults, etc. Again, that's a lot of young folks who are victims of firearm violence. Looking at firearm violence perpetration, the next slide. We see that 3.3% report ever perpetrating firearm violence. Although a small share, it's still a critical group because perpetration, victimization, and exposure often overlap. And we'll cover that in just a moment. And again, you can see that the risks are not the same for all folks in the sample. There's variation by demographics. Next slide, please. Okay, no, that's it. Okay. No, going back one. So the most sobering figure I think we have is that nearly 70% of youth, 7 in 10, have indirect exposure to firearm violence or risk. And this varies considerably by demographics. So we see that higher likelihood of lifetime indirect exposure from females, young adults, our youngest group, Black African Americans, American Indian, Alaska Native, other races and multiracial young folks, and young people living in lower incomes in urban areas in the South and West regions. Okay, next slide. And then just to sort of reiterate a couple of the points I've made, there's a lot of youth involved in firearm violence. 29 million of our youth are carrying firearms, 10.7 million are victims of firearm violence, and 3.7 million are perpetrators of firearm violence. So the sheer scale underscores why, sort of when thinking, I think, about prevention, that a one-size-fits-all solution is not likely to work. Okay, next slide. So I want to say something about the fact that this overlaps. We did some latent class analyses, and we were able to determine 4 distinct firearm profiles. These results are published, and we could share the paper with this group. And what we saw was, in the 4 groups, we saw a low violence group, which is 62% have almost no involvement. And we often see that, in other violence studies as well. Some folks some folks thankfully are not involved at all. But we do see that 19% of our whole sample is mainly in a bystander experience. Then we see another 15% that are involved in some violence, which is a mixture of victimization and self-harm. And then we see the high violence group, which is about 4%, and they're heavy across carrying, victimization, and perpetration. So these profiles, we think, will help let us target our interventions for universal prevention, perhaps for the first 2 groups of the low violence and indirect exposure groups, but then thinking about more intensive wraparound services for those who are, let's say, in the high risk group, that 4%. And again, that's not a trivial number of young Americans. This is in the millions that we're thinking about, even when we think about this smaller 4.4%. See if we go to the next slide, please. And just a few limitations that everyone should keep in mind as we're thinking about these study results. Of course, we have self-reported data, which anytime you're using that, there's always going to be questions about recall bias or even social desirability bias, where folks may want to exaggerate perhaps what's going on. But this is kind of offset, I would say, by the nature of the collection that we did using online methodologies, which allow for private collection of this. So there's really not a lot of reason why someone would feel like talking to an interviewer that they might have to exaggerate what's happening. We also had a modest participation rate of about 33%. Now we addressed this with non-response weights and overall weights that we applied to the sample to bring it in line with the proportion of demographics that we had in our sample. And for now, we're only presenting the cross-sectional data, but we do hope in the future to be able to present our longitudinal data. The other thing we should mention also is that this a panel-based sampling method was used, so it may not fully capture, youth in other higher risk environments. So youth who may be jailed, unhoused, those may be involved who are not in stable enough housing situations to be in a study that NORC is conducting based on household samples. A couple other things about the implications of the results. We'll go to the next slide. First, we think that culturally responsive strategies are essential. The concentration of harm among young men of color means prevention must be community guided and trauma informed. We think that's going to make a major difference. And we also note that sort of exposure to gun violence during adolescence often can be seen as a risk factor for future gun involvement, with nearly 10.7 million youth and young adults having experienced gun violence. And this kind of emphasizes, we believe, the urgency of these efforts to think about prevention. And we also saw that communities with higher victimization rates require, we believe, more tailored support systems, including trauma-informed care. If we can go to the next slide. We did see a high level of awareness of gun violence, which indicates sort of a potential, we think, for more bystander intervention type programs that could be that might be effective with our youth, especially those who have not experienced it yet. We also think that prevention specialists can implement perhaps evidence-based strategies such as conflict resolution, training, and community-based gun violence prevention programs as a possible way to educate youth about the risks. And we also believe it's going to be important to address structural determinants of gun violence, such as thinking about some of the usual things that we think in the violence arena around poverty, lack of education, racial disparities, and we believe this can help mitigate risks. So with that, those are the main results of the study. Now I'm going to turn it over to my colleagues. Okay. They can jump in. Okay, we'll go to Nina. It's all you.
Bruce, thank you again. Thank you, Ashley, for your introduction. I'm Nina Vinnick. I'm the president and founder of Project Unloaded. You may have noticed that I am the non-academic on this panel. My role today is to offer an example of how the data that Bruce shared, as well as other data, are informing prevention and intervention aimed at reducing youth gun violence. But first, what is Project Unloaded? Let's go back. Okay, and there I am. All right, hello, nice to see you all and be seen. So let me just explain briefly what is Project Unloaded. We are a 3-year-old national gun violence prevention organization focused on educating, engaging, and empowering young people to change norms and narratives that are driving so many to believe that they need guns to be safe. Next slide. Data is really at the core of everything we do at Project Unloaded. Like NORC, Project Unloaded shares a commitment to research and data collection. Why? Maybe it's obvious to some, but maybe not to others. Why is data, like the data that Bruce shared, so critically important? Well, at its most basic, we need to understand the problem that we're trying to solve, and we need to understand the population that we're serving. This is especially true for young people for whom there is comparatively little data about their views and experiences when it comes to gun violence. The NORC study is really incredibly valuable because it contributes to our understanding of this critical population. But let's face it, data collection is expensive, and it's often prohibitively expensive, especially for smaller nonprofits. Project Unloaded is somewhat unique. We are a smaller nonprofit. We're not a research shop. But because of our commitment to research and data collection, we've invested in and released new research every year for the last 3 years because of its value for our work and for the field. In 2022, on the left here, we surveyed 1,000 13 to 25-year-olds nationwide to understand Gen Z's views on guns and gun violence. In 2023, we took a deep dive with the Black and Hispanic youth population in urban areas to learn about the perspectives of this unique population. And then last year, we looked into the intersectionality between young people's experiences and attitudes around mental health and firearm violence. Slide. Our research is also contributing other findings that are relevant to young people and their knowledge, attitudes, and behaviors regarding firearms. These are just a few of those findings. We learned that decision-making about gun use happens very early, making the teen and young adult years a pivotal period for decision-making and also for prevention and intervention. We learned that most young people lack any basic knowledge about the risks and responsibilities associated with having and using guns, but they are open to learning more. Social media is a big source of information for young people about guns and can contribute to misinformation and misperceptions. And finally, most young people are frankly put off by what they see as the polarized nature of the gun debate, meaning we really need to reach them in different ways than maybe what we've traditionally seen around this topic. Slide. The data also show a profound shift in the public's understanding of the risks around having and using guns that's taken place over the last 25 years. And what was most interesting to me is that the steepest shift in this changing perception has come among younger Americans. Slide. And it's really this data that led to Project Unloaded's theory of change. So what we do is develop creative cultural campaigns and community partnerships that are about empowering the next generation to choose on their own terms, not to carry and use guns. Slide. And now onto our logic model. So again, at the risk of sounding like a broken record, we always start with research. We invest in research to make sure that we are listening to the insights of young people. And then with those insights, we're developing our campaigns and community programs that can help spread and test the message with the facts on the risks of having and using guns. We meet teens where they are, on the social media platforms where they're spending their time, where they're seeking out information and finding community. And we're also connecting with them through trusted local partner organizations. We reinforce these messages over time, and with steady work and consistent teen input and participation, we can impact individual decision-making about gun use, as well as chip away at the broader community norms driving so many to use guns. Next slide. All right, so what does this look like in practice? Well, first, let me show you some examples of what our campaigns look like. Next slide. Our first campaign, launched 3 years ago, is called SNUG. On the next slide, Safer Not Using Guns. So SNUG uses engaging, fact-based social media ads and influencer posts focused on educating teens about the risks of having and using guns. We're using peer-to-peer content created by members of Project Unloaded's Youth Council. And so far, SNUG has reached over 5 million teens in cities across the country. During our pilot phase, we saw that exposure to the SNUG campaign led to a 15% shift in increased awareness of the risks of having and using guns and decreased interest in future gun ownership. Next slide. Our next campaign is called Guns Change the Story. This campaign was designed to reach teens in communities disproportionately impacted by gun violence. Guns Change the Story uses narrative storytelling to challenge teens to consider how everyday moments in their lives can change if a gun is present. We use zip code targeting to reach teens in neighborhoods that are struggling with high rates of gun violence. And so far, the campaign has been in 5 cities, including Chicago, Philadelphia, Atlanta, and Sacramento. Here in Chicago, we've reached nearly 200,000 teens, including with content that's localized by teens in our community partner programs. Next slide. Our newest campaign, launched just this month, focuses on the intersection between teen mental health and gun violence. With rising rates of firearms suicide among young people, the campaign helps them understand that guns make their mental health journey riskier. Slide. Now, through our social media campaigns, we're proving that we can reach young people at scale through their online networks. But that's not all we do. We're also reaching them in their offline networks through our community partner program. Slide. Working with trusted partners like Chicago Public Schools, Big Brothers Big Sisters, Chicago Public Libraries, and others, we're also connecting with teens on the ground in their neighborhoods. Using a curriculum developed by Project Unloaded that marries teens' love of social media with risk education about firearms, we're training teens to be content creators for good. In our pilot, we saw a 20-point shift away from interest in owning a gun after participation in the program. Slide. Youth leadership is at the forefront of everything we do at Project Unloaded. Through our Youth Council and Creator Corps, we're training the next generation of leaders in the fight against gun violence. Slide. There's a model for what we're building at Project Unloaded, and that model is teen smoking, where cultural campaigns contributed to a generational shift in the way we think about cigarettes, leading to a significant drop in teen smoking, along with rates of lung cancer. When we share this example with teens in our programs and ask them to consider what their neighborhoods would be like if we could provoke a similar shift around firearm use, we see them start to understand that they don't have to accept things as they are, and that they have the power to be part of that change. That's where the data can take us. My last slide on the next slide is my contact information and where you can find us on social media. Thank you.
Okay, there we are. Thank you so much. Thank you again to Bruce and to Nina for setting the stage here so beautifully. And thank you again to Ashley and the NORC team for having me here today. My name is Sonali Rajan, and I'm a professor in the Department of Health Studies and Applied Educational Psychology here at Columbia University. Next slide, please. So just a quick acknowledgement of the many, many collaborators and folks who make this collective work possible. Next slide. So we've my area of expertise really is certainly on the impacts of gun violence on children and youth, but also specifically in schools. And so I wanted to really build off of the conversation we've had so far today and talk a little bit about what is happening in the context of K through 12 schools and what that looks like. As you can see here, gun violence persists as a public health crisis, of course, and it disproportionately well, it impacts children all over the U.S. We estimate right now that more than 400,000 kids in K through 12 schools have been exposed to gun violence, specifically in a school setting, since the Columbine shooting in 1999. And I just use that as a marker to really just wrap our heads around the scope of this issue and how we're making sense of it. And so in particular, this growing up with gun studies is really allowing us to make sense of what is happening now and then think through how we might address this gap. Next slide, please. I bring this slide up really to underscore that we have historically really lacked in funding and resources to really meet the moment and meet the challenge here. And so you can see that bottom yellow line. This is a graph from a study that was published in 2023 by Gitterman and colleagues, but really underscoring the lack of federal funding and resources we've had specifically to study this as a scientific issue. Next slide, please. So I could talk to you all day about this, and I'm just going to do a very brief overview to underscore the impacts of gun violence on children in particular here. And you can see this slide is very dense, and I'm just going to give us a brief highlight, but unsurprisingly, gun violence, whether direct or indirect experiences, and well, obviously the Growing Up with Gun studies has allowed us to underscore this, just has so many poor health, developmental, and emotional implications for kids. Profound emotional trauma, long-lasting anxiety, disrupts, understandably, right? These experiences disrupt children's sense of safety and security. It contributes to profound grief. It impacts learning, regulation, their ability to regulate emotions. I mean, you name it, you can think of a health outcome, a developmental outcome, and gun violence and its exposure and its experiences contribute to exacerbating and making those issues worse. Next slide, please. In addition, and again, perhaps unsurprisingly, and we see this underscored, we saw this amplified in the Growing Up with Guns study, but work by my team, by this new study and others have really underscored racial disparities in childhood exposure to gun violence around the US. And so what we've seen here, right, and consistent with this new study, is that Black children are disproportionately exposed, Black children disproportionately experience more neighborhood firearm violence than their white counterparts. And there's so many implications for this, but among them, of course, the need to address this as the public health crisis it is, but also the critical need for really strong data systems to allow us to really quantify and measure, and again, make sense of the scope of the problem, but also where those disparities lie. Next slide, please. I also want to take a moment when we think about the implication for gun violence in schools. It's also important to recognize that there are implications for teachers as well. And this actually stems from work by one of my doctoral students who just conducted a narrative inquiry that explored the lived experiences of classroom teachers and revealed very significant impacts of school-based trauma on their mental and physical well-being. And the reason we care about this so much is there's a wealth of research that has really underscored the connections between teachers' health and well-being and their ability to support our students. And given the scope of the crisis, we need to ensure that our teachers are supported and cared for along with our students as well. Next slide, please. Additional work that my colleagues and I here at Columbia are doing, again, building off of what we've seen in other research in this field, but really trying to make sense of, okay, what are the impacts of gun violence, both direct and indirect experiences on students, teachers, and staff in K through 12 schools across the country. And so really trying to make sense of how mental health and perceived safety among teachers and staff are shaped to some degree by the anticipation of school gun violence, in addition to the documented negative impacts resulting from direct exposure and experiences with school violence. So again, thinking about what our kids and teens need, but also recognizing that they are part of this larger ecosystem in which the adults in their lives who provide care for them on a regular basis also need to be addressed and supported as well. Next slide, please. So building off of the Growing Up with Gun study, and also in line with work that my colleagues and I have done, we're really making a call here to shift the way we think about how we address this issue. And so the first half of what I'm talking to today was very much underscoring the devastating scope of this crisis, but I just want to take a couple minutes here to underscore that there are some very specific steps that we can take, evidence-informed strategies that we can employ to really mitigate this issue and reduce its related harms. So here, as you can see, what we're trying to do is shift our way away from constantly reacting to this crisis and shift our infrastructure, our resources, much more into prevention. Next slide, please. So to move forward, so the current study, this new study's findings coupled with our parallel work have really underscored that we need to broaden the spectrum of what currently constitutes school gun violence prevention and really reimagine the prevention of school violence as an opportunity, not just to reduce gun violence, which is so important, but also to meaningfully invest in our schools, its surrounding communities, and by extension, our kids and teens. Next slide, please. So I'll just going to give like the quickest overview here, and then of course we'll be taking some questions. So let's just start a little bit of a kind of leaning into the ecological model here, and again building off of our study, the new study's findings and work that's also been done by several others. But thinking about those community level investments in green space, ensuring access to affordable housing, street lighting, access to community-based programming that really engages youth during later adolescence, investing in public libraries, investing in after-school support. There are very specific things that we can and should be doing in the community to really move this work forward. In the same vein, we want to see positive changes to the school environment. So this new study really emphasized the importance of evidence-informed bystander interventions and really changing the social norms within a school environment, which is so critically important. And again, not relying on one specific policy or practice, but recognizing that solutions to this public health crisis will and should rely on a multifaceted approach that thinks about every lever we can possibly. So we want to use all our tools here, right? And all our tools in our proverbial tool belt. Next slide, please. The school safety piece is actually a really specific area that I just find very interesting, and I think gets a lot of attention, but there's very limited evidence as to what we know actually works. A study that Charlie Brandis and I here at Columbia are just wrapping up, we just finished all of our data collection for this, has allowed us the opportunity to study over 24 school safety strategies in a sample of nearly 650 K-12 schools across the country. And we're making sense right now of which of these strategies, whether they're lockdown drills or arming teachers or metal detectors, which of these strategies alone or in combination are actually effective at deterring gun violence, if at all. And what is the role of some of these strategies, whether it's behavioral threat assessment, whether it is active shooter drills or other types of emergency preparedness, what are the role of these strategies in actually either mitigating harms or allowing us to do some reasonable emergency preparedness? Next slide, please. We also, in the next 3 slides here, I'm just going to give a 2-second overview, but really just to underscore that, yes, we need to at the same time be thinking about the mental health component. Again, this is supported by this new Growing Up with Guns study, but making sure that we need to expand the capacity of child mental health services in schools and employing all the ways in which we can really be advocating for and implementing access to services that are very, very basic and needed and have plenty of evidence, again, driving their value and worth. Next slide, please. At the same vein, we also do need to provide schools with the tools to provide early intervention and reduce those initial symptoms of PTSD. Really, what do you do? What are the kinds of tools we can implement here that we know are very feasible to utilize in the immediate aftermath after a child or a classroom or a school community has been exposed to gun violence? So what are the tools we can use there? There's actually a really nice evidence-informed set of tools, Listen, Protect, and Connect, and several others that are both feasible to implement and effective. So next slide, please. Lastly, we want to make sure that we are supporting our schools in committing to trauma-informed practices. And essentially what that does is it allows schools to help mitigate additional individual harms associated with school gun violence exposure. It gives them the tools to be able to assess symptoms of traumatic stress, to work closely with families and school nurses to best meet the individualized needs of students, and really collaborating with resources to ensure that kids and their families are supported outside of school hours, right, which is just as important. Next slide. Thank you. And so just to kind of bring this all together here, what we're seeing here, right, in this work is that gun violence is a huge national crisis. It is impacting so many children across the developmental stage, across the US, in communities, but in schools alike. We need a more expansive and evidence-informed strategy to really prevent this kind of violence from happening. That includes those community level investments, which we also need to implement evidence-informed school security efforts, think about thoughtful early intervention and mental health services and other sorts of after-school care and safety. We need to think about the mental and physical health needs of teachers and school staff and really reframe the discourse to be less about reaction and more about the meaningful prevention of this kind of violence, which is I can't think of an issue that's more critical to address. So thank you again for your time, and I look forward to taking questions.
So I want to thank, there we go. I want to thank each of you for your insightful presentations. It's really been a delight to be surrounded by the wisdom that each of you brings to the table. You know, it's clear that this study is critical as there's been an absence of nationally representative samples following respondents over time. And so this is a really big milestone in terms of sharing the study, Bruce. At the same time, it's clear that it's just as important to ground the research in reality in terms of the impact of exposure of firearm violence and evidence-informed prevention, which we heard from Dr. Rajan and Nina, which I really appreciate those perspectives. We've received a lot of great questions from our audience, and to get us started, I'd love to dig in on the study a little bit for a moment. We're going to start with you, Dr. Taylor, but then I'd love to have you, Nina, and Dr. Rajan weigh in on the same question as well. So going back to your study earlier, Dr. Taylor, your research found that about 69.5% of young people, which I think you defined as ages 10 to 34, have been indirectly exposed to firearm violence. How does witnessing firearm violence affect young people in terms of what you've been learning? Why is it important to consider, and what interventions might help?
Yes, excellent question. So indirect exposure to firearm violence, as you saw from our study, is all too common for youth and young adults. And just as a reminder, it includes measures such as do you know anyone who attempted or killed themselves with a firearm, seen or heard anyone threat or hurt others with a firearm, seen anyone shoot a firearm in a public place, heard but not seen firearm shots in a public place. So serious kinds of things. And there's others that we had 10 measures there. And, you know, thinking about that kind of serious behavior, I mean, a parallel to that, I think, is thinking about something like adverse childhood experiences, we call ACEs. And it, in a similar way, I think it raises risk for trauma, anxiety, school absenteeism, and potentially later gun involvement. Because nearly 70% of youth experience it, we think we have an opening for bystander type oriented programs that teach safe interventions and reporting. Our team at work with University of New Hampshire is starting to think about those kind of interventions and thinking about as we have these type of bystander interventions in the area of sexual assault prevention, we can imagine some similar interventions in the area of gun violence. And there are other evidence-based programs to draw on to think about addressing this indirect exposure. These could be violence interrupter programs, peer-led conflict resolution. There's also sort of hospital to school support programs that are there. I think this type of data really does give practitioners support to try to embed these types of interventions where youth already are. So where they gather, schools, community centers, and even social media platforms. Those are just some thoughts I have, but I'll turn to my colleagues to see their thoughts as well.
Great, Nina, we'd love to have you jump in terms of how does witnessing firearm violence affect young people, why it's important to consider, and what interventions might help.
Yeah, thanks for the question. This was a surprising finding to me, and I've looked at a lot of data on young people and their experiences with firearm violence. It's pervasive, right? It's nearly 70% of young people who have been touched by gun violence in one way or another. Some of them are anxious to talk about those experiences, but many of them aren't. And so I think we need to just be mindful of the fact that this is not a monolithic population, and those experiences and their reactions and how, one might reach young people around this topic really have a lot of variance to them. What we found in our research is that a majority of young people say that they worry about gun violence, at least on a weekly basis, or for some, even more often than that. So the fact that so many have had these experiences, it is impacting their day-to-day well-being and their mental health. In other research, we asked young people how concerned they are about their mental health. Just under half say, they are concerned. But when you look at just the population that has experienced gun violence, it jumps about 10 points in terms of concerns about their mental health. And I would add, there have been significant cuts to youth mental health supports and programs. So we need to really focus on the way gun violence is impacting young people in all aspects of their lives, not just their physical health, not just their mental health, but it affects their performance in school, their relationships, and on and on. And so I think that finding is just really a wake-up call, I think, for all of us to really focus more about how we can reach this young population. And that's really the work that we do at Project Unloaded. We want to meet young people where they are. Some, as I said, some are anxious to talk about this, but many aren't. And so we have to find other ways in through other topics that they're already having with their peers. We need to make the gun issue not so heavy, not so weighted as it is in so much of our discourse, and make it lighter, and find ways to connect with young people that will keep them engaged and make them interested in learning how they can be part of the solution.
Thank you for that. And Dr. Rajan?
Yeah, I mean, I'm really going to echo what my colleagues here have said. I so appreciate what Bruce brought up about gun violence as an adverse childhood experience, which is something my team and I have spent a lot of time really trying to think through in a thoughtful way. And what do we mean by an adverse childhood experience? I mean, when a child experiences what we call an ACE, it literally disrupts their neurodevelopment, which then leads to social and emotional and cognitive impairment, and then can lead to the adoption of high-risk behaviors. And it literally is like the CDC has a pyramid that literally shows the many ways in which experiencing an ACE places children and teens at high risk for every possible poor health outcome you could imagine. What I actually think is sort of amazing about, and one of the reasons I love working with kids and teens, is because the research, as devastating as what I just said is, and as devastating as the scope of this crisis is, something that I just so appreciated about working with kids and teens, because their brains are still developing and because of the developmental stage they're at, is what research has shown is that yes, ACEs place kids at high risk for all of these negative experiences. However, when we as a society provide access to and intervene early on in that aftermath of that ACE exposure, whether it's through grief counseling, family therapy, trauma-informed services, like whatever the appropriate intervention is, when we provide that intervention, that evidence-informed intervention and support, that actually mitigates a lot of the harms associated with that ACE exposure. If you couple that with other what we call positive childhood experiences, the like having trusted adults and creating safe and stable, supportive home and learning environments. Like when we do that, even in the aftermath of these exposures, it can do so much to mitigate these harms, which is kind of this incredible opportunity we have for intervention, right, with kids and teens. Like, and I just think that gives me, in some ways, a lot of hope in this, like, otherwise really horrific. I mean, when you look at the numbers here in this paper and in the work we're all speaking to, it's like, I think about this every moment of every day, and I can barely wrap my head around the scope of this crisis. So I just want to just sort of, to me, the ACEs piece is particularly fascinating because it provides us with a real scientific scaffolding for how we can understand where the opportunity is to successfully and meaningfully intervene. And I actually think that's really, really important for us to think about.
Definitely. I'd love to pull on that thread a little bit more, Dr. Rajan, from a question that's coming in. And I'd love to also open it up to Nina and Dr. Taylor to answer as well. You've listed out lots of different types of evidence-formed research and interventions, but what have you found to be the most effective regarding interacting and engaging with youth in your work, whether it be a program or research-based? I think it'd be helpful to hear from each of you on that aspect.
Well, I know Nina can speak to this so beautifully. I think what I'll just say from like the school perspective, honestly, is when you are investing in a school environment in such a way where, yeah, teachers are more supported. We have slightly smaller class sizes. It's like everything I'm saying is this isn't rocket science. Like we actually have access to full-time mental health support on site. You have a full-time nurse. You have opportunities for after-school programs that promotes pro-social development. You have access to clean and safe playgrounds. You have adults present in that during the vulnerable time points during the day. Like some of my colleagues and I just finished this really interesting study on that after school dismissal period as a really kind of point of volatility. Like when you invest in all of these components, and I know I get a version of this question a lot, which is like, what is the one thing? And my answer is always very unsatisfying, but there is no one thing. And I just think I can't reiterate that enough. We have to literally use every tool in our proverbial toolbox. When we do that, we see how things improve. We know that this works. But I really think I think just thinking about all of those components, like think about where we all live and work and spend our time. All children should deserve to go to a school and be in a space where they feel cared for and they feel at a fundamental level where they feel safe. And that can't just be in the school building. It means they have to feel safe on their way to and from school, like at home, right? So we have to think about kids as a part of this like larger ecosystem that as adults we have a responsibility to attend to. So
Nina, I'd like to invite you in to also add, and Dr. Taylor.
Yeah, so what I would say is don't be dismissive of social media. I think, as adults who have, long careers, we tend to think that social media is not serious. It's, not for us. It's just for kids. It's trivial, right? What we know is that young people are spending an outsized amount of time on social media for good or ill. They are going there for information. In many cases, they are using it in a positive way to learn new things and to build relationships and find community. And we know that they're learning about guns on social media. And so if we're not meeting them where they are on those platforms and developing interventions that incorporate those platforms, we're just missing the mark. And so that's the approach that we're taking at Project Unloaded. It's really what we mean when we say we need to meet young people where they are. And I'll just share one additional example of what that looks like that I didn't talk about in my presentation. So one thing we learned is that especially among teen boys and young men, they're learning about guns through video games. That is not to say that video games cause gun violence. There's a lot of research that disproves that proposition, but it is the case that for many, it's an entry point to learn about guns and experience virtual gunplay. We have a new campaign that's called Leave Guns in the Game, where we're working with online gamers and content creators to interact with other young people who are watching their content, who are watching them on Twitch as they play video games, and talking to them about why they're safer in real life without guns. So in a video game, by all means, go all in with those guns. They can help you, power up and win those games. But in real life, guns only make us less safer. It's a way to reach new audiences. It's a way into what can be a, somewhat, polarizing topic in a much less aggressive way. And we found it to be incredibly effective. We're getting the most engagement with that campaign of any of our content at this stage. And, we really feel like we're onto something. We can talk to young people about guns without being direct and political and partisan, right? There are other ways into this topic that can be really effective.
Yeah. It's so helpful, especially when you're just speaking to how you're engaging young people separate from the survey work. So I'm really curious, Dr. Taylor, from your perspective, what have you found to be effective regarding interacting and engaging with young people through the survey research, which seems like a completely different avenue than how Nina was describing some of the work that she's done. So I'd be interested to hear your thoughts.
Yeah, I mean, I think part of what we need is creating a data infrastructure to study these problems. I mean, the most success we've had in public health has been where we've had data. Think about like drinking and driving and all the success that's been there to reduce that. The other thing I would say is that, of course, there's not enough research on this topic about what works and what's effective in the area of firearm violence. The one thing I would say where there has been promising work more generally in violence prevention has been in place-based approaches using environmental crime prevention. I think there's a lot of promising work there that I just wanted to add to this discussion.
Each of you have said something that triggers a new question for me. So you're making this very easy as a facilitator to ask new questions. So Dr. Taylor, I'm going to start with you. When you're talking about future research, where would you like to see us go? What unanswered research questions would be helpful to explore in the future? And of course, I'd love to hear from others on that question as well. Oh, you might still be on mute.
Yeah, they got a mute button there. There we go. I mean, for us at NORC, in terms of the work we're doing, a priority would be tracking our sample longitudinally to see how these early exposures then translate into adult outcomes. So we have, a very unique sample. We have funding that takes us for 3 waves of data collection, but we'll be looking for additional support to continue this because once you have a national sample, that's a difficult task to do, and we've gotten really good cooperation in wave 2. A good large chunk of our folks who participated in wave 1 have participated in wave 2. So we really like to continue tracking this. And I think the other thing, some of the unanswered questions would be testing combination strategies where we're looking at, for example, hospital-based programs and violence prevention combined with school-based programs. I think there's a synergy there, and I really liked Sonali's work in working with schools and thinking about how you think about the samples she's collecting in schools to what we're finding from the more general population out there. So those are some ideas that I have.
Same question for you, Dr. Rajan, and then we'll have Nina.
Okay, see, this is when you ask professors, like, what do you want? I'm like, I got to talk about all these new research ideas all day now. Nina and Bruce will be writing new proposals together. I mean, honestly, the opportunities are endless. I think something that and I know Ashley and I, we've talked about this, like, there's been a lot of sort of a rapid uptick in really new ideas that have been developed very recently over the past few years, like really thinking very creatively out of the box about what are solutions to gun violence that disrupt cycles of disenfranchisement and really get at those upstream determinants of health and thinking about prevention with a real true like lens of what prevention, so thinking about prevention like months and years before a teen chooses to pick up a firearm and with the intent of hurting themselves or someone else. I think there's just so much opportunity way before that. We're like, we tend to talk about gun violence prevention in this sort of myopic way, not we here, but like collectively the public discourse that tends to situate themselves right here. And I think we want to expand that discourse to be as expansive as possible. So I would love if to for work to really look at what is working at this, maybe at the local level or at maybe smaller scale. What programs are we seeing having these smaller effects here and there, and saying, wait, how do we scale that? I actually think there's a lot of opportunity in our field to think about how we scale some really great ideas that are happening more locally, but to other communities and places around the US. And then also exactly as Bruce and Nina have been talking, like, how do we think about then measuring and evaluating all of these interventions together to really look at the scale of the impact? So a lot of the examples like I provided in my portion of the talk have been studied and evaluated, but looked at one at a time. And I think what we want to think about is how do we look at those school safety strategies alongside the green space investment and the, XYZ? How do we think about those interventions in combination? And I think what we would see, my hypothesis here is we would see, oh, there's a lot of, yes, safety benefit, but also a lot of economic and other benefits we would see as well. So
definitely. And Nina, we're going to give you the last word before we wrap up in the next couple of minutes.
Well, first, I would say +1 to everything my colleagues have just said. And the one thing I would add on this last question is I think looking at the data and parsing younger teens from older teens and young adults, I think is really important. I mean, I think it goes to Sonali's point about the need to really reach young people, well before they're at a point of wanting to pick up a gun. That's the approach that we take. And that means, I think, in many cases, intervening at a younger age. And so we really need data that helps us understand, what's unique about the, 12, 13, 14-year-olds as compared to, older teens or young adults.
Great, thank you. And with that, I really want to thank our panelists for such an engaging conversation and our audience for your time and attention today. We received so many great questions, and I know we weren't able to get to all of them, but we all are available, through our websites and LinkedIn for any follow-up. A special thank you to the communications and events team here at NORC and to Jackie Sheridan Johnson for all of her assistance in organizing the event today. We really hope this session has provided valuable insights, and we encourage you to continue exploring and discussing the research further. This is a heavy topic and really deserves, more time to explore and discuss what you've learned here today. To learn more about our work at NORC Center on Public Safety and Justice, follow our LinkedIn page. We can also drop that in the chat. And we want to thank each of you, and we hope you enjoy the rest of your afternoon. Thanks so much.